Hi, welcome to your Checkup. We are the patient education podcast where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicole Rufo. I'm a nurse.
And we are so excited you were able to join us here again today. While we're recording this, our bellies are full with cream of mushroom soup and sitting in complete darkness. Because this isn't video, you won't see that Nikki has her hair wrapped up in a towel.
I do. I just took an everything shower.
Usual fashion.
I had to wash my hair because tomorrow's my birthday.
And tomorrow's your birthday. I'm so excited. I love your birthday.
Mm-hmm.
We're going to go to dinner, and Nikki doesn't know where we're going yet.
Mm-mm.
And I wouldn't nefariously reveal it while we're live here, at least for the recording purposes. But it'll be a day spent at work. But when that's done, we'll spend a lovely evening together. And I have a little breakfast planned for you, too. Mm-hmm. So I can't wait to celebrate you tomorrow.
Oh, thanks, Eddie.
Well, you're welcome. So what did you think about the cream of mushroom soup?
Oh, it was delicious. It always is. I think we can add it to the recipe book.
Oh, yeah. I love this tradition. So, like, you started doing the yearly photographs in the book, and
I think our 2024 one just got delivered.
Like, as we speak?
No, I had it delivered to my parents because we can't have anything nice in this city and can't order anything to our doorstep without the risk of getting it stolen.
Yeah, the thieves are called porch pirates, for anyone who's wondering.
Yeah.
It plagues our neighborhood, probably surrounding neighborhoods too. I think they case the Amazon truck and they go behind, and there are these people who are walking by taking packages. I've seen it live in front of me, and usually you don't approach them because, you just don't know. But Ollie tries to help sometimes.
Yeah, he doesn't like them either.
He doesn't like them either. But like I was saying, you have the 2024 books, and now you have this cute recipe book of all of the things that in your handwriting, which I think is so endearing in today's technological world, of all of the major meals that we eat. And I think it's amazing.
Ollie likes my receipts too.
Ollie also likes the receipts. It's receipts. It's definitely not the jingling outside the door. But our intern is very active tonight. And without further ado, why don't we get live into our episode today? Today. All right, Nikki. What are we talking about today?
Today we're talking about human metapneumovirus.
Yes.
Otherwise known specifically in the media these days as hMPV. That's what I've seen during my research.
Oh, geez. Yeah, you brought this. So this is a Nikki special. You brought this episode up and, brought it to my foresight to produce an episode on this because this is in the so-called zeitgeist. Mm-hmm. And, it's all over social media, the regular media, and people seem to be, much like the bird flu that we did a little bit earlier, very nervous about this, and possibly reasonably so after everything people went through in 2020. But we're here today to talk about, in a measured way, human metapneumovirus, which we both have seen. And we were talking as we were going to Acme and about this and felt like it would be a good idea. Well,
because I keep getting served this content of people and their misinformation, which is another whole episode that we'll talk about, but basically saying there's this new virus, this virus called Human Metapneumovirus, or they'll just write the hMPV, and how awful it is, and we're going to have another pandemic, and we're going to have another lockdown, and like saying that this is a totally new thing, and it's not. So we're going to talk about it, because if you're also getting served the same thing that I am, and you have no knowledge about this, it's probably scary.
Exactly. And so just to kick us off here, we'll, of course, dive into more detail, but the headliner is that human metapneumovirus is a very common respiratory virus, and it often circulates with other viruses like flu and RSV and a long list of other things that cause the common cold. And so, like Nikki was saying, the goal of this episode is to inform you all about human metapneumovirus, its symptoms, prevention, treatment, and current trends. And so, speaking of current trends, where are we in terms of human metapneumovirus? So during the wintertime in the northern hemispheres, there is an uptick of acute respiratory infections, and that includes human metapneumovirus. And so what you probably have been seeing is that in some countries like China, that they've been seeing increases in human metapneumoviruses recently. And so what I want to clarify is that these increases are generally within the expected ranges for the winter season. And they look at this and they compare it to old times and new, and this is all within expected ranges. Ever since COVID and probably before that, human metapneumovirus is being monitored alongside other respiratory infections. And it's the World Health Organization that's doing this. And overall, we lean on them to track this data and participate in active surveillance to make sure that the trends are staying where they're supposed to be and see if there are any changes in potential severity. But to that end, it seems like everything is lining up where things normally do in the winter. So, Nikki, because you've probably seen this a little bit more than I have on the pediatric side, can you explain to us what human metapneumovirus is?
Yes. Well, it's a very common respiratory virus that will cause cold and flu-like symptoms, can cause worse things in, high-risk people, which we'll talk about. But
right.
For the normal, healthy person, you're going to have a cold. When kids have it, I do think that it's one of the ones that are a little more nasty.
Yeah.
But at the end of the day, the symptoms are really all the same. Mm-hmm. And it spreads just like any other virus with like droplets touching surfaces. So
right.
Maybe don't have someone like sneeze and cough in your face and wash your hands.
Right. Yeah.
Classic advice. This is not rocket science.
Yeah.
If someone's sick, it's the same thing.
Yep. Is there a certain time of year that it normally spreads more than others?
Yeah. In the classic like cold and flu season. So winter into like the early spring.
Gotcha. And then can you kind of run us through, I'm seeing typical symptoms here. Nothing spectacular. Cough, fever, sore throat, which throws a lot of people off because I think people get a sore throat and they're like, oh my God, it's strep.
Mm-hmm.
And a lot of times, in fact, most of the time it isn't strep. Running or stuffy nose, body aches, and headaches. So typical flu symptoms there. And then more like severe symptoms can include wheezing, difficulty breathing, sometimes chest pain, dizziness, severe fatigue, dehydration, persistent fever. But like you mentioned earlier, we're going to talk about which categories of people are at higher risk for that. And so why don't we go there next, actually? So which groups of people are higher risk when it comes to these viral infections, and in this case, human metapneumovirus?
Mm-hmm. So really the same as any other virus that we've talked about. So infants and really kids under 5 years old, older adults, if you have any kind of like chronic respiratory condition like COPD or asthma, you're just unfortunately might be hit harder if you get some sort of respiratory infection. And then if you have any kind of immunosuppression.
Right. And moving into this next section, talking about how to prevent human metapneumovirus infection. Well, we've talked about it in a couple other episodes. It is how to prevent the transfer and spread of any other virus. And if you are really concerned, you may consider wearing a mask. And if you can improve ventilation in certain areas, and to ventilation being the actual specific flow of air, you can open a window, practicing hand hygiene, washing your hands, singing happy birthday while doing that will do you some good. And stay home if you're not feeling good. Remote work is a thing these days, and be honest with yourself. If you're not feeling well, you might get other people sick. And so probably partake in some of that social responsibility. And then, Nikki, when it comes to, is there anything else there that we should really go after? It's all stuff that we've talked about before.
Yeah.
And is there anything different about treatment options for human metapneumovirus other than like over the counter?
No, nothing special. There's no vaccine specific or like antiviral. For this one, there are, like symptom treatments like Tylenol, Advil, if you have a fever or you're achy, stuff like that. Hydration and rest.
Sure.
Until you get better. Ride it out.
Yeah. Yeah, nothing too special there. But speaking of special, this is actually a pretty interesting piece. Maybe we spend a little bit more time on these next two items. The diagnostic testing. So a PCR is an acronym for a biochemistry process called the polymerase chain reaction. It doesn't matter what that means, but what it does is it can get to the DNA or RNA of a virus or a lot of other things and identify what a sample is. And so you're taking nasal swabs or pharyngeal swabs, and you're going out there, they're doing these tests and finding out what the heck the virus is, which is very different than how things were done before PCR testing, where we're kind of talking here about like riding it out and it not being terribly important for a lot of people because 95% of these infections and things that give people colds are viruses that go away on their own.
Yeah.
But the PCR changed everything.
Yeah. Probably not for like the best. Don't you think? I think it makes people more anxious.
Yeah, I think
when like for like COVID and the flu, there are things you can like that will alter like things that you do in treatment potentially if someone wants that. But like at the end of the day, if you have human metapneumovirus, rhinovirus, adenovirus, the OG coronavirus, like it doesn't matter because the course of the virus is pretty much the same across the board. You're going to feel crappy.
Yeah.
You're going to get sick. You're going to get better.
Right.
And it doesn't change anything.
It doesn't change anything. Yep. There's like, I guess, of course, there are exceptions to all these rules, but in the vast majority, the people who live in the middle, this won't change.
Yeah.
And why would you, there's a big theme, at least in our training, that like if you won't make a change to the management, why would you get a test? Or if you're going to order a test, you should have a reason for it because you're going to act on it and you know what to do with it. And if that's not the case, you should think twice about ordering that test. And I think this is exactly what happens here. I mean, like during the times of COVID, sure, especially when they came out with some treatments, but it also changed your social behavior, right? Like if you knew you had COVID, the timing was different that you would isolate. But I mean, these days, these PCRs are coming out, usually in children. They're getting a swab and they're getting a long list of all these potential viruses that it could be. And these tests are hundreds of dollars. And I mean,
for nothing.
For what?
Yeah.
It's not completely useless in every single situation, and sometimes it's illuminating that like if you have a kid who looks really sick in front of you and you don't know why, and they can't tell you why, sometimes it can be reassuring. And if that's what you're chasing, then maybe. But it's an expensive thing. Knowing that like the COVID, flu, and RSV are the ones that usually go on like a standard mini PCR, basically. And then there's the expanded ones that include the long names.
Yeah.
I remember seeing a kid who like really was down bad for a couple days at the hospital for human metapneumovirus. And day in, day out, you come look at them and it's like.
Yeah, they get like punky pretty quick.
I'm like, oh, it's still this? And they're like day 3. And I'm like, we're still there? This hasn't gotten any better? And then you start asking questions of yourself. You're like, could it be anything else? And eventually you do your due diligence. But like, I mean, you probably saw that day in and day out.
Yeah. I mean, it's like nice in the hospital sometimes to know because like you're probably going to get a PCR like in the ED just because that's what they do. Probably, especially if you're getting admitted. And then you just kind of have an idea of like, as like a nurse or like the doctor, like kind of what to look out for and what they might do. Like, I guess really, I don't know, like that one's one. And then like RSV with like the time frame of that and when they might kind of crap out before they get better and when to kind of like be more on alert. But yeah, we're still doing the same stuff. So it actually doesn't matter.
So, I mean, there's an argument both ways probably. I mean, the people who make this and sell this are probably like, do it everywhere. But there's probably an in-between that people will find themselves eventually, maybe or maybe not. All right. So we had some time. We had a good time there talking about these little couple notes about diagnostic testing. And
Yeah. So when you are getting served misinformation about human metapneumovirus, report it for fraud.
Ooh, yeah, that's a good way to be.
Spreading misinformation.
I know you've been really passionate about that. We've got, loads of ideas.
It's very frustrating. I'm going to have a lot to say. We're going to do a whole episode about the rapid spread of misinformation and how dangerous it is. And I have a lot to say. I think you probably do too.
I do. The whole essence of this podcast is essentially to try to combat that.
Yeah.
And so
if it's harder to spread correct information than it is to spread misinformation. Like
Definitely.
If we were out here saying all this made up stuff, we would have gone viral by now.
Oh yeah, definitely. But no, we are taking a measured, level-headed approach to educate people and bring medicine closer to them. And Ollie's very passionate about this too. So overall, this is a public health issue, I guess, as well as probably getting a cold yourself.
It's January.
It's January. So
people are, and that's like another thing I kept saying too, like a sudden spike in this virus or like a sudden, yeah, it's cold and flu season. There are spikes in the viruses.
Right.
It's been that way for ages.
And people have to be okay with that. And as we get years out of COVID, of which now we're from the start of it, moving on to 5 years out, that this does happen. And people pay attention to it. And so take a breath. It's fine. Come back to another week of your checkup.
Hopefully this episode doesn't age poorly. It's Tuesday, January 14th, 2025.
Thank you for dating that.
Hopefully it doesn't age poorly and we find ourselves in another pandemic a couple months from now. That would be awkward.
It would be.
We would have to cancel ourselves.
But I don't think it will. And like I said, the WHO, as in the World Health Organization, looks at all of this stuff and they're monitoring it. And really, there's been no behavior that's been outside the range of what is expected. And so that's all we kind of have to say about this on this week's episode of Your Checkup. Thanks for coming back. Take a look at our website, share with a friend, a loved one, or
a neighbor.
And check out our Instagram. We're on TikTok. Send us some fan mail. You got a topic that you want? We're still taking those health goals. They've been coming in droves. And until next time, stay healthy, my friends. I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for a complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.